Hi, everyone. My name is Nicollette Gooding. I am a Master's of Social Work student at the University of Toronto, currently completing my Practicum with For a Safer Space. Today, I will be sharing information about violence within the violence against women sector and how impacts of violence can contribute to substance abuse. Alcohol dependency has been found to be up to 15 times higher for women impacted by violence than the general public. Research shows that a large proportion of women who use substances are victims of violence in their relationships, incest, rape, sexual assault, and child psychological and physical abuse. For example, the United Nations has recognized that experiences of relationship violence have led to increased alcohol and drug dependency in women. Women impacted by violence are more likely to smoke cigarettes, use alcohol heavily, misuse prescription drugs, and use illegal drugs. Additionally, victims of violence are more likely to use multiple types of substances and to use higher levels of substances than those who have not experienced violence. It's important to remember again that a large proportion of women who abuse substances have faced forms of violence in their personal relationships. When having a client in terms of supporting them on a journey to self healing, remaining mindful of using a trauma informed approach due to the range of what the client has experienced is important in providing that trauma informed anti oppressive support. Within substance use services, and Canadian researchers have illustrated the link between violence, mental health, and substance abuse. Within substance use treatment, approximately 40% of women have a co occurring major mental health disorder, and up to 67% have a history of abuse, and almost 50% are still currently in an abusive interpersonal relationship. Despite the prevalence of mental health conditions founded within social contexts of violence, many services still lack the adequate support. In another study of substance using women from 9 treatment centers across Ontario, 85.7% of the 98 women in the sample had been victimized. Women reported being a survivor of adult physical violence, childhood sexual violence, and childhood physical violence, as well as adult sexual violence. Despite this evidence, many services continue to still fail in adequately responding to these connections and supporting women. Violence and substance abuse. Women who use substances for a variety of reasons, but many women who use these substances and who access anti-violence services report using substances to cope with the violence, the resulting effects on their physical and mental health or other stressors in their lives. For example, many studies show in transnational houses that the number one reason women gave for using alcohol was of a way to cope with the everyday realities of their hardships. The researchers also found that supporting women around their experiences of violence and other stresses can in turn reduce their levels of substance use. Abusers often introduce women to alcohol or drugs, thereby increasing their dependency on their partner. Many women have described that their substance use began or even escalated as a response to their experiences of abuse at the hands of their partner, and how this substance abuse created almost a temporary safe place being with their partner, and that even using those substances would cause an increase of violence and control tactics at the hands of their partner. And this is why it's important to be mindful of these existing contributors, to women's substance abuse in providing non-judgmental, trauma-informed care. Thank you for taking the time to watch this video, and take care.